manifested also in the greater use of coercion in mental health services, particularly for people from Black communities, and an even greater use of community treatment orders when people leave hospital. We know that women, particularly young women, have far higher rates of poor mental health than men. And we know there are greater risks for people who are disabled, living with a wide range of disabilities, and people from LGBTQ+ communities. But crucially, that's not, and it's very easy when we're talking about mental health inequalities to think it's something about the groups of people who experience them that causes the inequalities. And fundamentally, this is wrong, and we need to change the narrative, because what we know is that our mental health isn't the product of our strength or weakness or character or personality. It's about the lives we lead, the environments we're in, and the experiences we have in life. And mental health gets made in communities. And it's crucial to think of mental health as something that gets made. It can be good or poor. And for many, many people, the protective factors which keep many of us well and allow many people to enjoy good mental health are balanced against risk factors which cause poor mental health. And it's the balance between the things that protect and promote our mental well-being and the things that chip away at it and cause it harm that determine our chances of having good or poor mental health. So yes, anybody can have a mental health difficulty, but your chances are very much related to your position in society and your experiences in life. So mental health inequalities effectively are about wealth and power. And of course, they're very complex. All the causes of them come in many, many different overlapping and interlocking factors. But fundamentally, we know the inequalities to do with money and resources in life, and of course, housing and built environment are incredibly important. But power inequalities are fundamental too. Experiences of oppression, exclusion, discrimination, violence, and adversity. We've seen enough of that in the last year, particularly in the wake of the murder of George Floyd and the murders of Sarah Everard and Sabina Nessa. These are the inequalities in society in terms of power and the use of violence that create excessive risks for many groups of people. So what can we do about it? Well, fundamentally, we need to think about inequality in mental health at the heart of everything that we do in terms of both public policy, but also mental health services and systems. And no matter what our role in that system, no matter what we do as someone who works in the system or volunteers in it or is involved in it or is a citizen, there are things we can do to bring about a change. We know that institutions, for example, thinking about schools, workplaces, criminal justice system, local government, health services, they can all help to reinforce good mental health or mitigate risk factors for mental health difficulties. They can actually reverse mental health inequalities, but sometimes what happens, unfortunately, is that they reinforce the inequalities that were there in the first place. And we see that particularly when people are coming into mental health services through coercive routes. And unfortunately, what we see is that there's a triple barrier. People whose risks of poor mental health are greater very often have the poorest access to support for their mental health. And I don't just necessarily mean formal mental health services. And having had access to services, unfortunately, have the poorest experiences and the worst outcomes. So what do we need from a system that's designed for equality? Fundamentally, we need four big areas coming together. We need to ensure that communities and civil society are in the lead and are given the ability, the power, the resources to make a difference where mental health gets made. We need government policies that support equality in mental health and that actually enable those things to happen. We need to look at the role of local authorities and local systems in terms of creating the right conditions for good mental health, using that anchor institution role that particularly they have as large employers and economic actors in their local areas. And of course, we need mental health services that are actively working for equality across every dimension. So just looking at some of the key elements. First of all, we do need to have a real commitment to reduce income inequality. This week has seen a major backward step in the reduction in universal credit payments by £20 per week for many, many people. That's estimated to put 500,000 more people into poverty. The effect on the nation's mental health is likely to be dramatic as a result of that. And we really need to look at how policies of that kind could affect people's mental health and see them through a mental health lens. And we need to look at the benefits of beginning to change that. A fairer benefits system, potentially looking at minimum income guarantees, for example, and ensuring fair access to housing is incredibly important. We need to look at the potential of the living wage. Any organisation here that pays people to make a living, are you using living wage accreditation? Are you ensuring that everyone you pay is being paid at a decent rate, and all the organisations you contract with as well? Because that can make a difference and create healthy workplaces for everyone. Of course, we need to look throughout life, and my colleague Kadra is going to be speaking about what we can do during childhood to support equality in mental health. But of course, within mental health services, we also need to ensure that we really do take advantage of the commitment that the NHS in England has made to advancing mental health equalities, to really begin to change the way mental health services are working with people across every dimension of inequality and the ways they intersect. There's so much more I can say, but I do need to keep to time, and I do want to ensure that we have lots of time for conversation. So fundamentally, this is about everyone coming together. It's our collective shared responsibility to make mental health equality something that's achievable, rather than just accepting forever and a day that those inequalities are there and will never go away. We can do this. We can all play our part. There are things we can all do individually and collectively. And I'm looking forward to the rest of the conversation. Thank you.
Thank you, Andy. And I must just quickly say that this will be available on YouTube. It's being live streamed now for those people who couldn't get a ticket, but it will be available to rewatch later on. I mean, Andy, that, you know, it's always very powerful to hear you speak about this issue. And I think that the point that you make about the very policy that we've seen this week about universal credit is one well made, and that we know that to really deal with these issues around inequality, that we must tackle every aspect of society. It's not just about mental health services. So thank you for that. I'm now going to invite Rose to speak to us, if that's okay. And Rose leads the Mama Health and Poverty Partnership, and is going to share some of her thoughts and reflections with us today. I can hear some background noise, so if you've got your microphone on, please turn it off, and then we'll get Rose up here. Thank you.
Oh, thank you, Sarah. Can you hear me? All right. Thank you very much for inviting me today. I'm very grateful to be here to be talking about mental health in an equal world, as is the theme. And I've been asked to talk of the experience of racism and how it affects people from Black communities, and also how policies which can reduce poverty will also help to reduce mental health, but also the strength and support that communities have to get themselves out of these issues. So I hope you all agree with me when I say that racism is using race or color to judge or treat people in whatever way that anyone decides. And as a Black African woman, your color goes before you, and you are very, very much aware of this in everything that you do. And speaking for myself, my accent as well goes before me. And there's so many things that, like the lack of, cultural understanding and immigration, and people expecting a call, a knock on their door, living in that condition for so many years. For some people, it's been like 20 or so many years waiting to be allowed to live in this country. And of course, being a woman. So there's a lot of intersectionality when it comes to talking about racism. So even without having any mental health issues like bipolar, anxiety, eating disorders, schizophrenia, everything, people, women, black people have all this going before them. Then people are labeled as aggressive, uncivilized, and always angry. So even before anybody gets an assessment or a diagnosis, all these assumptions and biases go before you. Sometimes, especially for us who come from other countries, there's another level of racism there, because we come into a community that you're not accepted if you came as an immigrant or an asylum seeker or a refugee. All that also adds on. So there's a lack of trust. There's a lack of trust, and our intellect is always queried. So all this causes stress, anxiety, depression, and for most of these issues, we come from communities where they have no name. There's no name for some of these issues in our community, because you're expected to be either a macho man or a woman who has to be there for everyone in the community. So postnatal depression doesn't exist. You have to be strong and brave for your baby. You have to be, that type of woman. So all that goes before us. And when then something happens and you've got a mental health issue, it is very, very difficult to get a proper assessment because of that. And when you look at an example of a woman that we worked with, she was in Manchester, a hospital in Manchester, and when it came to the report about her, they said she refused to eat, and she was speaking gibberish, and she was pulling out her hair. But after getting in a culturally appropriate caseworker, it was because she didn't refuse to eat. She was fasting because she was praying, and she wasn't speaking gibberish. She was praying, and she was removing her braids. We get braids, we get locks, we get wigs. So she was removing this, and because of that, she got a worse assessment than she should have got. So all these things like counseling, it means nothing to some people. If you look at Maslow's hierarchy of needs, if you are at the bottom, where all the things, I've been listening to what Andy has shared, the statistics, the wealth and power, your outcomes can be very, very high, because if your physiological needs are not met, which is food, water, and shelter, which many of the people in my community do not have, then it impacts directly on your mental health. So that is how people present with their mental health issues, and it's directly linked on, like Andy said, your background. We don't have access to resources. And if you look at how COVID affected the Black community, it's not because of COVID. It's not COVID that's killing people. It is what COVID finds. COVID finds a battered body because people have to work exceedingly long hours for very little money. And Black and African communities work in the 3 C's: catering, care, and cleaning are the jobs that are available for people. So it is working very hard for so little, no promotions and skills that we can't use when you come to this country. So all that affects people and impacts on their mental health. So policies, when you talk about policies, no recourse to public funds is the biggest one, where systems are locking out people who are in need, dire need. It leads to homelessness, and there's no access. If you've got no recourse to public funds, that's it for you. It doesn't matter. So it impacts on parents. It impacts on domestic violence, because people can't live an abusive relationship because they'll be we've worked with women who've been taken back to abusive relationships. We know children, the Children's Act and the UN Convention, very good, but are they being adhered to? Because we know children who are living in situations that nobody should live in, and children's services can't do anything about it because of no recourse to public funds. The DV bill is leaving out, the domestic violence bill needs to include women who are immigrant. They're not protected. They're not covered. And the right to work, people are very skilled, but immigration laws and the systems lock them out. And of course, people with lived experience are not included at the decision-making tables. And some policies and statutory, especially statutory policies, when they're being made, they are not culturally appropriate for people. So all those systems are locking out people who need help the most. So how are communities providing strength and support to themselves? It is important to consult with people. Even the most primitive communities do have structure. And people shouldn't be imposed or told what to do. They should be consulted and involved. And whatever policies, whatever support should build on what people already know and have. People just need love, kindness, and being listened to. I think for me, that's the biggest thing of all. Loved, kindness, and being listened. Everybody is battling something. Everybody is battling something, some more than others. And we need to create environments and spaces for people to do so. And it's also important, that spaces like this should be resourced and people, power being handed over to people to be part of decision making in a way that makes sense to them. So I want to share a link. I think maybe Alicia shared a link about a young girl whose mother I only met yesterday, called Sianda. And Sianda is a young girl born in this country and lives in London, has a boyfriend who is Welsh, I think, and she'd gone camping with this family, and something happened. She was attacked by two white men and a white woman. And the area where she was is very, very racist, but the boyfriend had a bit of a drink and left her with this family members. So she was attacked, she was beaten, and so many things happened. But just to highlight the incidents that escalate mental health issues for Black people, the police ignored all evidence. Even though she had a footprint, or a trainer print on her head, all evidence was ignored. The investigation wasn't done thoroughly. They missed out about 17 minutes. And the police didn't capture anything. Anyway, she ended up getting 4.5 years. And this is a girl who had I think it's a brain operation. And she can't run or sit on anybody's chest, as the evidence says, because she's had operations on her knees. So she has physical disability. However, and she worked as an HR manager, no criminal history or whatever. And you can imagine the impact this has had not only on Sianda, her mom, her family, and all her loved ones. And nobody else was questioned in this incident except Sianda. So you can imagine how the systems fail people, and in this case, you can't help to wonder, is it because she's a Black woman? Is it because of her issues that went before her? So I just want to leave you with that query. And also, I've asked Alicia to share the link so you read more about Sianda and just have a think about how this is affecting her family and many other Black people. Thank you.
Rose, thank you. And I'm sure everybody who's listening understands why we felt it was so important to have you speak today. I think, again, very powerful words relating to the everyday experience of Black and racialized communities in this country. And I think I'll certainly be reading about Sianda and thinking very deeply about it. I think there is no doubt her race will have impacted absolutely how she's been treated and how her story is being regarded. So I hope that we can honour her story in a very different way. And I'm sure that there's lots of people in the audience that will have questions for Rose. So please do ask them in about 10 minutes or so. I am going to open the floor for questions. So on that note, I am going to invite Kadra to also speak to us about the experiences of children and young people. So Kadra, over to you.
Thank you, Sarah. Good morning, everybody. I'm really sorry that you're stuck with me instead of the wonderful Puffy Jaman, but I'm really pleased to be joining this event to help shine the spotlight on the mental health inequalities faced by children and young people. And Sarah, I also had to dig up the one yellow thing that I own in my wardrobe to help mark Hello Yellow Day with our friends at Young Minds. So almost every week, there's a headline focusing on children and young people's mental health. Last week, NHS Digital released their latest data on the prevalence on children and young people's mental health problems. And sadly, we see that the sharp rise in mental health problems reported in last year's report, it seems to be staying with us, with 1 in 6 young people in England still reporting mental distress. This is an increase from 1 in 9 in 2017, suggesting that the pandemic is taking a toll on young people's mental health. Our own research conducted by my wonderful colleague, Nick O'Shea, also estimates that around 1.5 million children and young people under the age of 18 could see new or increased mental health problems due to the pandemic. And this relates to a range of problems such as depression, anxiety, PTSD, trauma, and bereavement. However, what is often not included in the headlines is the fact that inequality is a key driver of poor mental health outcomes. Experiencing inequality and adversity predisposes children and young people to a range of mental health difficulties that can really have a profound and lasting effect on them. And much like the trends we are seeing in adulthood, the pandemic has really exposed the inequalities faced by children and young people, and many groups have sadly seen them widen. So what do we know about the effects of the pandemic? Babies, children, and young people have endured so much during the course of this pandemic, and there has been really little recognition of this. Their lives have been disrupted because of school closures. Many are increasingly living in households affected by poverty or in households where, sadly, abuse and neglect is taking place. And so the research we've been looking at has really been exploring these trends, looking at actually some groups of young people have been, severely impacted more than others. We've seen that children and young people with disabilities, autism, learning difficulties, speech and communication needs have really struggled to access the provision they need. They were already struggling prior to the pandemic, but this has worsened. And many have been really impacted by isolation and loneliness during the period of lockdown, which is, again, a major risk factor for later mental health problems for them. And as Andy and Rose already covered, young people from racialized communities have been really impacted by the pandemic, both directly and indirectly, with higher rates of COVID morbidity and mortality rates, impacting their communities, but also they've been disproportionately impacted by the financial pressures brought on by COVID. Our work on young Black men, sought to explore this amongst one group as part of our Shift in the Dial partnership. It really revealed that young Black men in particular were being hardest hit by job losses, educational disruption, and have had and have been disproportionately impacted by new coronavirus police powers, you know, so being, you know, up to 7 times more likely to be given a coronavirus fine during the lockdown period. And I can share a link to our briefing on this a bit later. Data also shows that around 2/3 of LGBT young people saw their mental health worsen during the course of the pandemic, compared to just under half of their non-LGBT plus peers. A charity called Just Like Us have done some incredible work in this space. So I would really urge you to kind of look at their research in this area. Andy also mentioned child poverty. Again, we've been massively concerned by this. The research that was published last week by NHS England shows that young people growing up in households where they've struggled to pay bills or, you know, afford food during the pandemic were twice as likely to report mental health difficulties, which is why, you know, that £20 uplift in universal credit is absolutely vital for young people. However, the pandemic and lockdown have also positively impacted some groups of young people, such as those who had been previously struggling with things like school-based anxiety. Digital learning and that flexibility of learning actually has been really, really effective for some groups. So it's really important for us to think about how we can build on this learning and take that forward. So what needs to change? I just wanted to share a couple of key messages that we've been pushing for recently. We're really proud to be working with some of our friends on the sector on our campaign called Fund the Hubs, where we've been calling on government to make a national commitment and investment to roll out early support hubs in the community so that all children and young people and families can access a range of immediate support and advice all under one roof without needing a referral or facing lengthy waits. There are already a small number of hubs in existence across the country, and they really demonstrate positive outcomes for young people facing multiple disadvantages and inequality. Secondly, I think we desperately need a cross-government approach to infant, children, and young people's mental health. At the moment, there are many departments running programs focusing on supporting children and young people in the COVID recovery period, but they're not as joined up as they could be. And sadly, those children and young people facing inequalities may not benefit from these initiatives. Alongside this, I think children and young people's mental health services have also been really overstretched and limited due to decades of chronic underfunding. Before the pandemic, children and young people's mental health services received just 1% of the overall NHS budget. So we desperately and urgently need sustainable investment in children and young people's mental health, from prevention and promotion right all the way through to crisis. Yeah, I think that's all for me, Sarah. Thank you.
Wonderful. Thank you very much, Kadra. And I think it's no secret that we at the Centre have been concerned, and alongside the Coalition and Coalition partners, about the increasing number of children and young people trying to access services. And of course, what we've seen during the course of the pandemic, particular issues like eating distress and so on, increasing, but as well as those social factors around domestic violence and, again, deepening poverty. And so you know, there is a perfect storm of issues here. And one of the key points that we make at the Centre is very much that this is not about making children more resilient. Children are already incredibly resilient. It's about changing the system around them to help them thrive. They are very different questions. And so we always try and make that distinction. Okay, on that note, we do have some questions from the audience, which I'll talk to now and then invite panelists to respond. Jane has asked how organisations might work more closely together to make policies more effective, particularly when resources are quite limited, and that, you know, she makes a very important point that just visiting an MP or, you know, doing one thing for 20 minutes isn't going to make the real difference. So how do we really influence change here? And I wonder if we could hear from Rose actually first about, you know, how have you influenced change locally?
By knocking on doors again and again and being annoying, saying the same thing, taking our women with us with lived experience to share their stories, and sometimes being seductive to the people that make policies. But seriously, it's saying things again and again and again and again, and trying to represent on local boards, and especially around after the pandemic, we are working more closely with statutory, who have started taking us seriously because we know where the hard to reach people are. We've made them able to reach them, and because everybody knows that to fight COVID is a collective job, so if a Black person hasn't washed their hands, it's going to impact you directly. So I think we've had, COVID has brought its issues, but also opportunities to work together. So we are working more closely with statutory and policymakers who are kind of realizing that we are in the same world. However, it's still a long walk for us.
And I remember the first time I heard you speak, Rose, one of the things that you said, and you sort of alluded to it there, you know, we work with them to help them deal with hard to reach people, because you've always made the point, people aren't hard to reach, organizations are just not reaching them. And so I think that making that distinction all of the time and holding that line has been incredibly important. Andy, Kadra, do you have any thoughts about how organizations can start bridging these gaps in terms of policy change?
Yeah, it happens at multiple levels, doesn't it, as well? Because I think we're wanting to change national policies. We know that national policies set the tone for other things, and harmful national policies can cause an enormous amount of difficulty and really making it next to impossible locally to do the right things, whereas positive national policies can really help to move us along. And part of it is about taking every opportunity we can. So we've seen over the last 10 years the slow kind of erosion of Sure Start services, but we're now seeing family hubs as a kind of new version of that coming along. That's an opportunity to really have a focus for better early years support for young families. I think what's really interesting locally is we have seen organisations like Rose's that really have built a relationship with their statutory partners and that are valued. Unfortunately, what very often happens is that they're existing on tiny amounts of funding. It's very short term, and that inevitably means there's very little room for them to really have that advocacy role. And I think it's so important with statutory bodies, whether you're in the NHS or local government or any other bit, that you really are working equally in partnership with community-led organisations, user-led organisations that have the knowledge. As Rose said, there are no people who are hard to reach. You're just not reaching people. And having that way of partnership working that allows that advocacy role, that being difficult role, the voluntary and community organisations, whether you're working nationally or very locally, that's such an important function, and it's not valued nearly enough, but we will certainly know the value of it if we no longer have it.
Quite. Kadra, do you have any comments on that question?
Yeah, I just wanted to add one final point to already Rose and Andy covered that brilliantly. I think, just, don't forget to involve children and young people in the process as well. It doesn't mean that their voices can't be heard through policy making as well. And, we've been really successful in terms of the Fund the Hubs campaign. Over 5,000 young people signed up to this open letter and, demanding themselves that Rishi Sunak funds the hub. So it's definitely possible, and we should try and, identify opportunities throughout the policy making process for that to happen.
Absolutely, and I think that that's right. And in fact, one of the pieces of work that we're doing with UK Youth and the Diana Award is about creating a group of change makers from racialised communities who will impact on mental health services up and down the country. So do look out for that. We'll send around the link. I have another question. How can local communities create equality in mental health when local authorities have had their funding cut so much over the last few years? Andy, I'll come to you first on this question because I know it's something that you are constantly trying to deal with.
Oh yeah, it's extraordinary. While the NHS has really struggled with the funding that it's got and continues to find real difficulties, particularly in the mental health system, in local government we know it's far more challenging. We've seen public health services, which we don't often value in the context of mental health, is to actually secure our well-being, have lost something like 25% of their funding. That's a quarter of all money in public health has gone over the last 5 years. We know that social care is an incredibly important part of the mental health system, but our debate nationally about social care is still predominantly about very important services for people in later life. So local government's absolutely at the heart of this. It's really struggling. And yet local councils, they look after housing, they look after the places we live in, that they cover pretty much all the things that support our well-being. So while we're making the case, as we should, for fair funding for NHS mental health services, we need to make sure we're supporting local government too, and continuing to make the case to local councils to put mental health at the front of their agenda. We'll certainly carry on doing that, and I know many colleagues on this call will as well.
And just from your perspective, Rose, I mean, I think it's that negotiating, you know, new pieces of work or new ideas or new ways of doing things when the narrative is we don't have the budget. How do you have those conversations? And someone did ask a little bit more from you around the decision-making processes locally, and how do you feel like you influence actual decision-making in terms of people's experience of services?
First of all, we need to reduce the bureaucracy and red tape and think of a cultural appropriate service for people, and also involve more of the voluntary sector. In Oldham, where I live, we've just, the head of the council has created a task force group to which I've been invited to participate and take part and represent women like myself. So by doing such things, it does help a lot to involve everybody. And I know there's cuts being made, but also it will create a lot of social value to the money that's been reduced. So if we can get more people involved, lived experience, and certainly working together and listening, because sometimes you attend consultations and you know you're just ticking a box, but where you are listened to, it is meaningful and it helps to create a better service.
Absolutely, thank you. We have one question here that I think is really important one, and I know that Kadra, through our work with Shifting the Dial in Birmingham and others, you'll have something to say about this. What more can we do for young Black people to help them deal with the psychological impacts of racism?
Thanks, Sarah. So I think, you know, firstly, we have to do as much as we can to firstly eliminate the racial stressors that impact their mental health. And so that means, you know, thinking about the organizations that support and work with these groups of young people, striving to become anti-racist organizations, ensuring, you know, that cultural competency is embedded through their interventions and through their work. We also definitely need to do more in terms of like funding organizations led by Black communities. So the work that Sarah mentioned in Birmingham does exactly that, you know, through a theatre group and through a young Black men's outreach and informal support group. I also think, it's about promoting equality in universal settings for young people. So thinking about embedding, the Black curriculum, for example, is a really great initiative. It's not just during Black History Month that young people should learn about Black history. It needs to really be incorporated at all levels. And through the Changemakers program also that Sarah mentioned, it's about giving young Black people a platform to be heard in decision making. So at the moment, there's very limited opportunities. When we talk about groups being defined as hard to reach, the services are not hard to reach, but young Black people are probably the group of young people who are less likely to have opportunities to, be involved in decision making, both nationally and locally. And we really need to change that. And hopefully through our Changemakers program, we'll share some insights and learning around that.
Yes, absolutely. I mean, we anticipate that program will really, we're so keen to hear young people's voices in a different way. I think that, that there was a really interesting conversation over the last few days about children and young people's mental health. And we often refer back to social media as being the kind of primary issue of focus. But actually, we know from lots of research that the issue around discrimination and poverty actually trumps the impact of social media. So again, really helping us to get a much more nuanced understanding of people's experiences, and we think Changemakers will absolutely help with that. We do have some more questions, and I'm just trying to kind of catch some. We've got one about intersectionality. Rose mentioned intersectionality, and I'd be grateful for the panelists' thoughts on how to develop strategies that work for broad communities yet respect the individual. This is a tricky one. Who would like to comment first on this? Andy, give it a go.
Yeah, I mean, I suspect this is where the great thing, where the knowledge is all on the in the collective community that we all are, and I think one of the things we really want to do is learn from where this is happening in real life. And one of the really fascinating things about putting mental health for all together is we were able to meet and to hear about work that does take an intersectional approach. And again, these are kind of big and complex words, but working work that comes from communities and communities within communities. So I'm thinking about Taraki, for example, which works with people from Punjabi communities, and they again, they have groups for men, for women, and a specific group for LGBTQ plus people from the Punjabi community, so that they can build up that kind of mutual support within particular groups. And the great thing actually about the modern world and the fact we're able to communicate on our laptops and phones is that you can create communities without being limited by geography. And I think that does have a real power. And we know many groups of people who have had experience of the mental health system have used digital and social media to organize and come together in really different ways that begins to challenge some of the norms. You look at the campaign to deal with SIM services and the approach that was being used in many parts of the country that was incredibly coercive towards people with complex traumas. So I think we are beginning to see that there is opportunity for power shift, but inevitably power shift doesn't happen readily or easily. And I think it's crucial then that we look at how we can enable that to happen in a much more meaningful way, rather than what would traditionally happen, which is that power structures of old find a way to recreate themselves. So that's not going to be easy. But again, I do think there is something crucial about what happens at the local level here. And I do think we have seen many local authorities. We certainly saw some really interesting examples in Bristol, City of Manchester, Leeds, and many other places where that intersectional approach is beginning to be understood, particularly by colleagues in public health. And that's beginning to make an impact on the way decisions about how funding is used and services are planned are made. But it's early days, we've got a long way to go.
Absolutely. And I think one of the interesting things that's come up a couple of times now, and Rose mentioned also, is the issue of power, and how do we create new power dynamics, particularly locally, where really important decisions are being made. The national power dynamics are a whole other minefield, which we'll have to come back for another webinar on. However, I mean, Rose, what do you think about how we shift power? I mean, you talked about banging on doors, bringing your women with you, but I mean, that also must have consequences, you know. I mean, that's not consequence free on you, that hard work. I mean, what are your thoughts on that?
I think it should be what I hope it would look like would be a place where I mean, we've used a lot of legislative theatre whereby people have dramatized their lived experience in front of professionals, in front of decision makers, in front of statutory, to help them understand and remove their, you know, they're called lanyards, and put them on the side and be human and put themselves in that situation. And most importantly, what I think it would look like if we all do what we can on our own patch, because I know the systems are very difficult to dismantle. Why, I'll never know, probably in my lifetime, but they're very difficult to dismantle. But if all of us, if everyone does something on their own patch, if the first person who answers the phone when you call the MASH team goes beyond the, oh, no recourse to public funds, so we can't support this lady, and just goes to know that a little story and takes it back to their team meeting, and another one does that, I think the power, people will use power to benefit the community. Because sometimes, I mean, there's nobody I know who is as powerful as my GP's receptionist. Powerful, seriously. Especially these days, I've got to be very nice to her. Otherwise, I'll never see my GP or even talk to him on the phone. So we need to know that sometimes people who we need to break that power chain is the receptionist. If that receptionist won't let you talk to your GP, you won't talk to your GP. So if we get receptionists being nice on our side and listening, then we can break this chain. We can break that power. People can share power or use power more resourcefully.
Absolutely. I mean, you speak such truth, and I really think about Malcolm X, who always said, you know, it's not about sharing power. Actually, it's about recognizing the power in others, which actually makes the difference. Power absolutely can be shared. Thank you so much for that wisdom. We do have a few more questions that I do want to just quickly tackle. Somebody has asked about the needs of older people, and that this often gets lost in the debate about inequality, etc. Do we have any thoughts about this from panel members? Andy, have you got anything to add?
Yeah, one of the things that's really shocking, I think, is that surveys seem to show that people in later life, if anything, certainly in kind of 60s and 70s, have lower levels of recorded mental health difficulty than most other age groups, but it goes up really, really sharply in people's 80s and 90s. And some of that is linked to obviously changes physiologically and in terms of social role. The terrible thing, I think, is that's just taken for granted. It's almost seen as a given. Well, yes, of course, you're experiencing borderline, of course, you're depressed, and nothing is done about it. And the great thing is we know that psychological therapies really work for people in later life and make a huge difference. There's a huge potential with social prescribing to create more opportunities for people later in life to have good mental health. What we've done is just completely ignore it and just take it for granted. And I think we really do need to look at how we can improve support, again, with a whole range of supports. It's not just about one thing. But a whole range of ways in which we can support people's mental health and well-being in later life. And again, we need an intersectional approach to that as well. Older people from racialized communities may need specific forms of support. There's some really interesting work that we've seen working with older gay men, for example, as well, that has really shown that, again, you take that intersectional approach later in life, you can make a real difference.
Thank you so much. And I think we also should make a point that we haven't been able to spend very much time on the experience of people experiencing neurodiversity, you know, autism and other learning disability. And again, another area of intersectionality that doesn't get much attention. And sadly, within our limited time, we haven't been able to do that. But let's come back to that very important point. Is there anything, though, that anybody wants to say about that? I mean, Kadra, do you want to quickly say something about what's happening?
No, I was just going to say, we actually held a coalition webinar that's available on YouTube, and we can share the link to that, focusing specifically on the mental health of children and young people with neurodiverse conditions as well. So it's definitely an overlooked area, very poorly researched area as well. And, you know, lots of challenges around, you know, if a young person is assessed for autism, the sort of, it's called diagnostic overshadowing, and that would be the primary, you know, reason why they would be accessing any form of health service, not like they have other things going on in their lives. And, you know, it's really an area we need to, you know, do a lot more on. And yeah, we can share the link to that webinar where you can hear from fantastic experts who know a lot more than I do in this area.
Thank you so much, Kadra. And as always, we're rapidly coming to the end of time. And what's really interesting, every time we do one of these things, we think about, oh, maybe we won't get enough questions. And then, of course, we get so many questions, we can't answer them all. So we really do apologise for that. But we will come back to some of these things. And where we've got questions that we can easily answer using the resources that we've got, we will sort of send out an email after this event with all of those links. Look, we've got a few minutes left. Final thoughts from our panel members. And Rose, what would you like us to think about leaving today?
For me, leaving today, I just think we just need to be more kind, because all of us are capable of kindness, no matter what you're going through. We are capable of listening. Just have more time to listen to somebody, because that's part of healing. That's part of just being listened to. I'm just at the other end of fighting a cancer battle, breast cancer battle, but just being listened to, it helps you so much with, you know, your mental health. So let's be kind, let's listen, let's have time. I know everybody's battling something all the time, but if only we can be, if at work, at home, in the community, just listen and be kind. For me, those will be my closing remarks.
Absolutely. Thank you so much. And I think that one of the things that is wonderful about you is that you use the language of love and kindness in this work, which we often don't do enough of, and for all sorts of reasons we don't do that. And I certainly didn't come into this work for any other reason than the love for my fellow man and woman. So I think I really hear that from you, and pleased that you say that and you use that language. Andy?
Well, what Rose said. Yeah, I mean, I think fundamentally this is about power, and so much of it is. It's also about ceding power as well as taking it, and it's about knowing when you can be part of a change, no matter what role you have, no matter what position you're in. If you are in a position where you have power, where you have the ability to make change, where you have the ability to step back a bit and just allow things to be a bit different, and have some other voices when decisions are being made, and to make sure you really are listening, and listening with compassion, then I think we can really start to change things. And it happens in all the tiny actions that we make, the way we respond to people on a daily basis, the way in which we hold conversations, the respect we afford people in those daily interactions. And that really will make a difference in the long term. Obviously, there are big things we have to change to nationally, and we'll keep working on those. But if we do this together, if we hang together as a community of people who care about this, then we'll get a lot further than if we feel isolated. So thanks so much, everyone, for being part of this today.
Thank you, Andy. Kadra?
Thank you, Andy and Rose. Very powerful words there. I guess, the final message from me is also one relating to language and terminology. I think the ongoing narrative around children and young people being a COVID lost or forgotten generation is just deeply unhelpful and really damaging. It implies that we're accepting that the harmful effects of inequality is inevitable rather than recognizing young people's potential and committing to taking action now. So I do believe that we can help reduce the risks for many children and young people through concerted action and collaboration. Yeah.
Thank you, Kadra. I mean, I think one of the things that I think has been incredibly striking throughout this webinar is that we've been talking about both things that we can do locally within our reach and things that we can do on a national scale. And I think, what we're asking people to take away from this event is very much that we all have some role to play wherever we might be in the system, to either advocate for people in local services or to push these messages on a national level. Now, it would be remiss of me if I didn't say that you can donate to the Centre for Mental Health to continue our work in this way. But I would say that donations received today will be shared with Rose's organisation to support her work in furthering the voices of women who are experiencing discrimination and, as a result, mental distress. Before we close, because I feel like I am going to close the session, I just want to invite Rose back, just to ask you, Rose, one of the things that you've said today about love and kindness, somebody has just said in the chat, it can be really difficult to do that, and it can be really difficult to remind people about how you do that, in services, our colleagues, etc. So how do you, just quickly, a bit of advice to us, how do you remind your colleagues within the system to be kind? And are there any form of words you could share with us that we could take away as a script?
Well, for me, it's easy because I'm a Christian. And I just know that kindness and just listening to somebody and somebody feeling that you're listening to them can change a life. Just be just wake up ready, not to change the world, but to listen to one person. So I'm not saying people should go and do something extraordinary, but just think of yourself in that person's shoes. And for us, it's easy because when women come to us, the stories, I mean, we are, at the moment we've been dealing with a lady who came in her room and her husband was drowning her baby in a bucket of water. So if that person came and you're not even ready to listen, she leaves off worse off than she came. But even though we are not able to save that child, or we are not even able to support her with the psychological trauma because we're not trained, just giving her a cup of tea, just sitting at the same level, getting away from behind your desk and sitting, facing each other, COVID allowing, that's all we need to do. Just be prepared to listen. For me, listening, and it's the only tool. Just somebody, you can feel when somebody is listening to you with a bit of empathy and trying to understand. And it's okay for people like us to say, Rose, I didn't quite hear what you said because of your accent. It's okay to say that. But there's nothing as important as listening to someone. That's where the kindness begins. And then it's even okay to say, whatever you've said, I can't help you. And that person will just take your kindness and the coffee and the biscuit, probably, if it's the only thing they take off you.
Rose, thank you so much. And I have to say, you did briefly mention it, that you have just recovered from breast cancer treatment. And I have to say, I and the Centre for Mental Health are absolutely delighted that you have recovered. It's wonderful to see you, and it's absolutely, we need you in the system. So we also thank the universe for getting you through that treatment.
Thank you, Sam.
on that note, I'm going to draw the event to a close. Please do keep in touch with us. We'll send you more information after the session. Have a good weekend all, and hope you're well. Thank you.
Thank you.